So thank you for sharing. My next question is for you, Jennifer. Ensuring that Black patients have a voice in shaping maternal health policies is essential to addressing historical and systemic exclusion from these critical spaces. Collaborative efforts among healthcare providers, lawmakers, advocates, and community stakeholders can play a transformative role in fostering inclusion and agency. Given your lived experience and your strong advocacy in this space, what are your recommendations on how these groups can encourage the participation of Black patients in discussions and decisions surrounding maternal health policies?
Absolutely, and thank you. Let's be clear, Black patients are not hard to find, we are systemically ignored. And so I'll start with a story as well. 4 years ago, I had a baby girl here in Atlanta, and shortly after being discharged from the hospital, my blood pressure shot up through the roof, my temperature at its highest read 103.5, yet my provider consistently ignored my concerns. As a result, almost died. The irony of this situation is that I, at that time, was working in a state-appointed public health leadership role, where part of my responsibilities included designing maternal health solutions for others across the state of Georgia, while I myself was in a hospital bed, almost becoming a statistic myself. That is the irony of Black maternal health. And so, what can we do to make sure that lived experience or expertise does not come at the cost of lived experience? How do we embed more Black survivors, more Black birth workers, more providers into this critical work? And so some of the things that we need to do, we need to fund the front line. Doulas are not just accessories, they're interventions. We have data that shows morbidity rates, mortality rates go down when doulas are involved. So let's expand Medicaid to fund doulas. Let's fund our community doula programs. We need to make sure that Black survivors, Black birth workers are not only panelists, but policymakers. And so what does that look like in healthcare? Well, when we design our maternal mortality task forces and our review committees, let's make sure that these individuals are included and not only given a seat at the table, but a power, right? And so voting authority, so that our input is not only input, but it actually has tangible impact. Next, I would say we need to protect legacy. We know that Black midwifery historically served a critical role in our culture and our communities. And I think it's time that we bring those resources back into the community. And so, as mentioned earlier, we need policies in place to allow for licensing, to fund the education and the credentialing. And we also need to transform our healthcare systems so that that birth model is welcomed as an option for those who are interested. And the last action item that I will mention, we need data and transparency in our healthcare systems where maternal mortality is concerned. We need disparities data. We need data that puts side by side equity funding versus equity outcomes. We need feedback loops. These are things that I would say we need in place to ensure that the Black survivors, birth workers are in place and actually giving input that is tangible. And I'll end on this note. Here's what I do know. I had policy credentials, I had a public health title, I had access to healthcare leaders. I even had an amazing husband who stood by my side during the entire birth journey, and I still almost died. Black birth workers, survivors, we need positions that are not just symbolic, but that are structural, that are funded, and that are enforced. Thank you.